The challenges today is that the healthy food is much more expensive than the unhealthy food, and that's where the role of industry, marketing, all of that comes into play. But I always tell my patients that we as consumers have much more power than we think we do. If today we decide to stop buying, let's say, white bread from the shelves of the grocery store will stop putting that white bread because supply and demand have that relationship. So you, as consumers, can definitely drive the market towards healthy choices, and things are changing. Now we do see calorie listing in some places, for example, like local Panera Bread, Starbucks, and you can totally ask to get the calorie information whenever you go out to eat if it's not provided. And I think the more people ask, the more they will be forced to provide, and you can use that as a guide to making your healthy choices. So what is the cost of obesity? And whenever I talk about cost, I want to highlight that for me, cost goes beyond just money for healthcare dollars or trips to the doctors. We have to keep in mind the cost that is difficult to calculate, which is the psychosocial impact of this disease. The data that we do have is, of course, in terms of numbers, and one aspect of the cost with this disease is the number of times an average obese patient is going to try to lose weight using commercial weight loss programs. So this is a study that was published in JAMA, which is a medical journal, in 2005. And most of my references are going to be based on scientific evidence, and not what's published in regular magazines. So this data has been around since 2005, and it was a review of people following 4 popular diets of that time: Atkins, Zone, Weight Watchers, and Ornish. They followed these patients for 1 year and found out that 50 to 65% of them completed 1 year. As you might know, it's not easy to stick to one diet for a whole year. And the average weight loss at the end of 1 year is anywhere between 5 to 7 pounds. So pretty significant numbers when you think about the number of people who will sign up for these diets. And it's not that it does not work in some people, 20, 30 pounds, whatever they do lose. The question is, what is their net weight loss a year later? You want to be investing your time and energy in something that is going to be long-term. As long as you're on the diet, you're going to lose weight, and that's fine. But what happens when you're no longer on the diet? And the tendency is for people to regain more weight than they actually lost, and we call this the yo-yo effect. Of course, the day-to-day living, the clothing, the food also adds on to the cost. And insurance costs go up as BMI goes up because of the medical conditions associated with the high BMI. And I'm sure I don't need to tell you about this, since most of you are familiar with the cost of going to doctor's offices.
I'm not as tired anymore. I seem to be able to accomplish more things in a day. I can do more things with my son. My back pain is not as bad as it was in the beginning, because I am working out 3 times a week with a trainer, and these are the hardest workouts I've ever had in my life, and I'm surviving them. That's incredible. Before, after my fall that I suffered, I had problems with swelling joints, swelling ankle, not had any swelling, and I think I can contribute that to the weight loss.
I was on medicine daily for diabetes. I was on 6 or 7 different medicines for my different asthma problems, my different joint pain. Now I'm on one medication, and it's not for diabetes, and it's not for asthma. I just take something to control allergies now. That helps financially greatly, but it gives you just a better overall sense of well-being. And I think to be healthy, to be truly healthy, you have to be healthy physically and mentally. So the two work together, and it just even gives you more of a boost, and you can just get so much more success from it.
I had all kinds of problems. I was on 2 blood pressure medicines. My blood pressure now is down to normal. I was on an antacid because I had acid reflux from the pounds of sugar I was eating. I had sinus pills because I had the CPAP. I don't have to use anymore. I don't have sinus problems, so I'm through with the machine.
It's changed dramatically. My life has changed so much for the better. I feel like a person again. Little things like getting on an airplane and flying. I just feel like a person again. I love shopping. I love hugging my children and running and playing and walking and all the things that I wasn't able to do for such a long time. I just feel like a person.
I think by now I hope that I've clarified what obesity is, how we should measure it, why we need to do something about it, and also take responsibility of how we got to this point. Let's talk about the options for the treatment of this disease. So you have non-surgical and surgical options. Here I'm going to focus on what we offer at the Metabolic and Bariatric Center. And I put in these numbers, diet 6% success and medications 12% success. These are again numbers generated from studies published in medical journals. So it's not what I think their success is, it's what is proven what their success is. I just want to clarify, I'm not against diets. I'm just for lifestyle changes that can result in sustainable weight loss with resolution of comorbidities. And if there are majority of the people are not able to sustain that weight loss once they are no longer on the diet, then it's not considered success. As of right now, I don't believe in medications for the treatment of obesity, and the reason is because you have to understand what you are treating. The disease of obesity is still a mystery. We don't completely understand exactly what causes this disease, but we do know that it's not one thing. It's multifactorial. So the combination of genetic, environment, your behavior, a lot of things come together, and then once there are a lot of factors into the mix, then the rationale of using one medication to treat it just does not make sense. I give an example to my patients on this point. We have understood how cholesterol is made in the body. We know that certain things come together, there's a chemical reaction, the end product is cholesterol. And so if we develop a medication that stops one of the steps that is important in the pathway that leads to the cholesterol development, then it makes sense to use that medication. It'll stop the production of cholesterol. We have not figured out the chemical reaction that leads to obesity. Hence the rationale of using a medication to stop that process is, as I said before, does not make sense. Most of the medications that we do have available are mostly, we stumbled upon their effect on obesity as a side effect. So a lot of the psychiatric medications, their side effects are on weight, and hence then we are using those medication for the purpose of their effect on the weight. So I know there has been recent FDA approval of a weight loss drug. We'll wait and see how the results pan out. The history of weight loss drugs is not very good, because one gets into the market, it becomes the vogue, then a few years later you discover a side effect and gets off the market. So we'll see what happens with this one. But as of right now, in our center, we do not prescribe any medications. We do have non-surgical options in terms of the medically supervised weight loss program, which is geared towards education and lifestyle changes, and that is extremely important for the success of the obese patient, whether or not they choose surgery. So just to clarify, we have surgical options and we have non-surgical options. The non-surgical options is a medically supervised weight loss program with an emphasis on lifestyle changes, and I'll explain that in detail in the next slide. The surgical options, we perform the gastric band, sleeve gastrectomy, gastric bypass, as well as revisional surgery.